Hi, I'm Simon from the Height with Mike Foundation, joined today by Dr. Mark Rackley, absolute specialist in his field. But Mark, would you care to introduce yourself and give us a little bit of background about you?
Certainly. I'm Mark Rackley. I'm a adolescent and adult psychologist. I'm from Dublin, obviously. I'm not faking an accent here. And I I've been living in the London almost 16 years. I spent 7 years as an NHS psychologist, and then the rest of my time I'm in private practice. I treat patients from 13 anywhere up to one of my patients in their 80s. And I treat all kinds of general mental health conditions, so depression, anxiety, ADHD, eating disorders, all that kind of stuff is my area. I have my own podcast called I Have Issues. I do quite a lot of stuff in media. So anything I can kind of throw my hand in to promote mental health, to get people talking about it, to normalize it, to remove the stigma. I try and do my kind of my bit, especially because like this is my area and I feel like I should be doing this because it's my day job. Yeah, I love doing stuff like this, especially with organizations like yourself, because I feel it's the more that there can never be enough voices talking about this stuff. Yeah,
Uh,
and I
no,
talk a lot because I'm Irish.
brilliant. Well, thank you very much. And as you sort of running through your accolades and credentials there,
Mm,
you're obviously at the top of your game in this world. So really do appreciate you taking the
thank
time
you.
out to talk with me.
Yeah.
You mentioned the media there. Anything that
Yes.
and our viewers may have seen or may have heard of?
Yeah, you probably see I pop up on all kinds of places. I've done Good Morning Britain quite a few times, Sky News. I've been on the BBC. I was the resident psychologist for Big Brother back
Brilliant.
in the day on the Sunday night psychology show. Yeah, it's an interesting career being a psychologist because you know when you're studying to treat patients, you don't imagine you're going to be talking about the comings and goings in the Big Brother house. But hey ho, that's the
Yeah, yeah.
beauty of this career.
Absolutely, absolutely. So over the years that you've been involved, what would you say are
Mm.
the biggest learns you've had, or the most eye-opening moments as a therapist that you've witnessed?
I think for me, like, because I'm doing the job like almost 20 years, and when I started, social media didn't exist. Like,
Yeah,
it wasn't there, you know. I think Facebook was just beginning, but like Instagram didn't exist and TikTok didn't exist and Snapchat and all the things we have now. And I suppose it's a massive learning curve for all of us psychologists because that's especially because I work with teenagers, like that's embedded into people's lives now, and which means it gets embedded into our psychology, and it then has the potential to be good or bad for our mental health. I suppose that's probably one of the biggest things I've seen in my career is navigating social media in terms of its impact on people, but also how that then plays out in people's mental health. So that to me was a huge one, and I still find I'm still getting my head around it because it changes all the time, and also like we have at the moment, like it can be great, but then it can be an awful place as well. So for me, I just social media massive game changer, and also working through COVID as a psychologist was also a huge game changer as well.
yeah, no, absolutely. And you touched on it there, but I think a lot of the time we get such negative press around social media with how it affects our mental
Yeah.
health and comparing ourselves to others, people seeing a snapshot of people's lives. For my personal journey, it was actually a really, really helpful tool. I surrounded myself in podcasts, self-worth podcasts, quit literature from alcohol, and it had a really good place. Do you agree with that and think that there's its upsides?
Oh, definitely. Like I'm on social media,
Yeah,
but it took me a long time to jump on for that reason because I thought, well, I need to kind of be very careful because obviously, like I see, I see members of the public, and I am not going to go on and do something sensationalist, or you're not going to see me showing you pictures of my dinner. But I feel like there's definitely some very good voices on there. There's definitely people who are trying to make a difference and are speaking really solid psychological and scientific um, words. But then I also think as well, you need to be careful who you're listening to, and also if you're noticing this isn't making me feel good, or I'm not benefiting from this. And I think it's like anything; you need to be so selective in terms of what your exposure is, because unfortunately, it has the potential to, right, like in your case, Simon, it benefited your mental health. I know certainly lots of stories I hear is it has the opposite effect, unfortunately.
Yeah, absolutely. And you mentioned obviously the social media side. Any other changes you've noticed in those 20 years apart from social media, with a volume of people coming through, the stigma that surrounds mental
Yeah.
health? Or what are the main changes you've noticed in that time?
Um, I suppose it's an interesting job because, like, if you say, "Oh, is your job busy?" Is it what? Like, I think if you're
Yeah,
not busy as a psychologist, you're doing something terribly wrong, because the demand is so high, and it's huge, and then the need is so big for people to be seen. I suppose one of the changes I've seen is, and I'm going to be very careful what I say here because it is change, but in my opinion, it's not big enough change. Is more men starting to disclose um, their difficulties with mental health, and that's brilliant because that we need that. We need more men to come forward and talk about that, but it's not enough
no,
because the rates of suicide are still far too high. I know anecdotally I see more women than men. I'm sure lots of psychologists probably say the same thing, and it's not that like men aren't suffering, they are, but they're not getting help. And that's a massive problem in the gap there, because that leaves men incredibly vulnerable, of course. So I think we're changing that, and like the stuff you guys do is brilliant because you normalize men struggle with their mental health. You publicize this, which is brilliant. I try and do my bit as well. I feel we're moving in the right direction, and it's great. And I have seen change in that over the course of my career. But for me, it's not enough. We
no.
need more change here, because if the change was better, then we wouldn't be seeing the rates of suicide in this country in men at an all-time high.
I absolutely agree. I think one of the big things is the education piece around it for me. It's we are told, and I think people have got better at talking about their mental health and coming forward, but we're not really taught how to react if our friend does come and put their concerns on our doorstep, if you like, or
Mm,
raises how they're feeling, or not understanding what they're feeling. And there's a lot more we can do in the everyday, day-to-day side of things, where we're dealing with our friends, dealing with our siblings, our family. Have you got any advice to people on how they can start expressing their, um, I guess, how they could start helping others with their mental
mm.
health if they early signs?
I think first of all, recognize we all have mental health. Once you have a brain in your head, you have mental health. Like that's a given. So the only time you break up with your emotions is when you're dead, like because everything stops then. But while you're alive, you're going to be a psychological person. You're going to feel, and things are going to affect you, and there's going to be times when you're all right and times when you're not okay. And I think it's important just to normalize that. Like nobody has the monopoly on the best mental health. So like when I often hear like people say, well, I did really well, like I came through that and I didn't cry. Like that's nothing to be proud
No.
of. Like that's not an accolade. Like there's something wrong there if you're not processing your feelings. So I think first of all, it's just normalizing that, which is, well, yeah, you have your feelings and your emotions for a reason. They're hardwired into your brain for a reason, because they're there to help you navigate life. And I think certainly around the kind of conversation, I often say to my patients, it's far better you say something than say nothing. Like let the person tell you, no, I'm all right. But to say nothing is quite risky because that's kind of leaving you wondering, okay, well, is the person all right? But also, it stops the other person knowing that you're concerned. So, err on the side of caution. Just say it.
Yeah,
Like,
yeah,
just ask the person. Just and use an I statement. I've been concerned about you. So nobody can tell you like how to feel. If you're concerned, and you're concerned for a reason. So, an I statement, I'm concerned about you, or I've noticed this and I'm just worried. And then let the other person walk through the door that you've just opened. But if we don't open the door, then the other part, when we're struggling with our mental health, we're all up in our own heads and we're not necessarily thinking clearly, or we don't see the world as it is, that people are there to support us. So I, I feel very strongly that, yeah, it's the people with the good mental health that should be taking the initiative. Like, don't wait for the
yeah,
person
yeah,
who's struggling to come to you, because that's a big ask. It's like
yeah,
asking somebody with a broken leg, could you run down the road to me?
yeah.
Like, it's not going to happen.
No, it's a
So,
great,
take the initiative and go to them. Yeah.
it's a great point, and I think that's one of the great things about our foundation. It's normalizing mental health and encouraging people to get out and get in the outdoors and come on a hike, for example. Not necessarily
Mm,
making that huge leap to needing therapy or one-on-one counseling, but just getting active. And it's something I noticed from your page and your podcast. Looks like you're massively into your running.
I am.
So,
Big runner.
do you do marathons or anything like that? Or
Back in the day, I did,
nice.
Simon, yeah, but I feel my body's saying, I obviously have another one left in me, and I think I
Yeah.
do actually. But every time I do a marathon, I cross the finish line and I say, I'm never doing that again.
Yeah.
And I did. So, but I feel at the moment, not yet. Yeah,
No.
not
What
yet. Yeah, for
and
purely for pleasure. Yeah.
Yeah, absolutely. And what affects you? What do you notice personally in your mental health with your increase in staying active and doing runs and walks and
Yeah.
getting active?
I love it, Simon. Like, I try and practice what I preach with my patients. So when I encourage my patients to exercise and they see me on social media exercise and think, well, got a bit of freedom of speech there. So
Yeah, yeah,
and the reason I do it is I don't do it for time. Like, I don't wear a smartwatch or anything like that. I'm not interested in kind of tracking my progress. I run for my mental health because it clears my head. I run outside. It lets me just change
yep,
what's going on in my mind, because unfortunately, one of the consequences of my job is my head is filled with trauma quite a lot, because I'm listening to a lot of trauma, and it can be very noisy in my head because of
yeah,
what I do. So what I find the running does is it just clears my mind and it helps me regulate my emotions so that I can kind of work things through. So I run alone, I don't run with anybody else. I put some music on, I run outside, and I literally just let my mind settle. And the running massively helps my mind to settle, which means then, like, I'm minding my mental health, but also it means as well I can do my job.
yeah. No, I agree, and I think from my perspective, it's if you can't run yet, get out and have a walk for 10 minutes, 15
Oh
minutes.
yeah,
It's just the peace and quiet and tranquility that comes with having some time to yourself away from for your phone, social media, everything else that's going on in
yeah,
life, and just a little bit of downtime. I also find the reference to the marathon, having a sort of an end goal, to not put too much pressure on yourself, but to keep yourself accountable to getting out. So something I'd recommend it for people to set a challenge and work towards it. But no, I guess it's all well and good when you're in the right mindset. But what would your advice be to someone perhaps suffering early depression, who isn't
mm,
finding the drive to get up and get active? Any advice to someone in that regard as to how they could start motivating themselves more?
yeah. I would think, just simply, your brain is like every other part of your body in that if it's not working well, you'll get symptoms. the same way your heart will give you symptoms that it's struggling, or your kidneys will, and your brain will do the same. It'll give you symptoms. So if you're noticing that your mood is more lower and it's not coming up, or that you're not enjoying life as much, or you're finding the day-to-day kind of activities or tasks are overwhelming you, or you're finding you're kind of more emotional, or that you want to sleep more, or your changes in your appetite, or you're feeling a bit hopeless, they're symptoms. And
Yeah.
you're getting those for a reason. And it's a bit like any symptoms. Like if I suddenly start having pains in my heart, I might go, okay, what's that? But if I ignore those pains and I'm getting them every day, then I'm actually I'm leaving myself really vulnerable to those symptoms getting worse. So if you're noticing that, then that's happening for a reason. So like anything, like don't wait till the symptoms get worse. So like it's a good idea to check things out with your GP. Your GP is never going to say, you're completely wasting my time here. What are you doing? Get out. Like they're going to listen to you, and they're going to help you understand, okay, what these symptoms might be. Or if you're concerned, talk to somebody and just say, listen, I don't feel like I don't feel myself. So even just having that conversation with another person doesn't necessarily need to be a medical professional, but it just helps you to first of all validate what's happening, and then allow for the support to come to you. So I always say, and I've said this so many times, like any area of health, preventative work is better than crisis. Because
Yes.
if you do preventative work, then you're hopefully preventing the crisis from happening. But unfortunately, I know certainly in my experience, I tend to do mostly crisis work, which I hate, because when I'm doing crisis work, then we're in a really bad place with somebody and we have to do quite a lot to kind of get that person stable again. So preventative work is far better in terms of just managing that person's mental health. And that's where we all come in, every single one of us, not just the doctors, which is, again, if we're noticing that somebody maybe is showing symptoms or is not themselves, just check in with them. Just check in. It's not you're not being intrusive or you're not being weird. Just check in with them, and then at least let that conversation start, so that if there is any action that needs to be taken, at least then the momentum has begun.
Yeah, no, absolutely. And I think from the Height with Mike Foundation perspective, if someone is wanting to start that, they're not sure whether they don't think they're quite ready for therapy, reach out to us. We can encourage, we can chat, we can come on a hike with us, get integrate you with other people, and just getting in the outdoors. So it's starting that journey earlier for someone, and if needed, we can then fund the therapy for people who need the help. So. Um,
Amazing.
Mark, I could absolutely speak to you all day about it all, but I know you've got
Uh,
your day job to crack on with. So
I
just
do, not unfortunately, just I would like to
yeah,
talk to you a bit more. I love these conversations. I really enjoy them because I feel these are so important, and just to keep highlighting. Like if it's just only one person that hears this and they do something, then that's enough.
yeah, and yeah, and again, I couldn't thank you enough for your time. I know how busy you are,
Pleasure.
and
Oh,
just
you're grand.
for anyone listening, if you want to just one last comment on where can they
Yeah.
see you and your podcast, what's it called, and where can people find that?
So my podcast is called I Have Issues, and it is on all the podcast platforms, Apple, wherever you get your podcast, it's on there. There's about 46 episodes now. The last one is with lovely Mike from your foundation. But there's all kinds of people on there. There's conversations with doctors, and there's conversations with specialists in their area. So have a look. Like it's it's not, they're not they're conversations that help for the public to understand mental health, and they are with experts who know their stuff. So if that's your first point, if you think there's ones up there on anorexia, there's ones on sex addiction and gambling, so there's all kinds of episodes up there. So if you're at all worried and you just want to kind of maybe just say, okay, what might this be? You don't necessarily have to go to your GP or a psychologist. It's a good starting point just to help you think about what might be going on.
Perfect. And no, I've listened to a lot, and they are great. So
Thank you.
thank you again for your time. Really appreciate you spending the time to talk to us. So cheers.
So, Simon, thank you for having me, and hopefully we can do this again a bit longer, hopefully.
Hopefully so. Thank you.
Take care, Simon. Cheers.
Cheers, Mark. Thank you. I'll let you get onto your call. I've stopped recording. Thank you. That's perfect. It would
Is
have
it
been
okay?